Good evening and welcome to this first Socket to Sarcoma dinner, or Socket in Style. I feel a bit awkward saying Socket in Style. Why are we here? Well, we're here because of this young lady who came to my office with her mum and dad, Steve and Mandy, in June, July of last year. And she had been diagnosed with Ewing sarcoma, and she wanted to make it better for other people with similar diagnoses. What she wanted to do was to improve awareness, because she said that when she was diagnosed with Ewing sarcoma, that's the first time she's heard of the disease. However good we think we are, and however hard we're working at the clinical services side of things, we can always do better, and this is an area we can improve on. But she particularly wanted to start research or encourage research into sarcoma molecular biology with a view to exploring new treatments in UWA, her university, and in Perth here. And she wanted that, if possible, to be world standard research, and we supported her in that concept. So awareness, what are sarcomas? Well, there are a wide variety of rare tumours, but together they make up a reasonable number of patients, and they affect adolescents and young adults, so that the average age of sarcoma at the time of diagnosis is below 30 years of age. Over the last 3 years, Jenny Woodhouse here has logged 690 tumours into our data registry. We see we look at about somewhere between 25 and 30 patients at our multidisciplinary tumour meeting every single week. There's been a 40% increase in the incidence, in the absolute number of sarcomas over the last decade. And there's no doubt that a specialist multidisciplinary unit can improve the outcomes. Why do I say that? Well, the first 50 patients that I treated when I came to Western Australia, I looked at critically, and I looked at those patients who've been treated outside the specialist unit versus those that were treated inside the specialist unit. So if they had their biopsy before they were referred to us, then they were considered to have had their initial treatment outside. And there are 28 out of 50 who fell into this category, too many to start with. Of that 28, a diagnostic... Am I preaching? There was a diagnostic delay of greater than 6 months in 14 of them. The diagnostic delay was defined as the time between their first visit to a medical person complaining of symptoms related to their sarcoma and diagnosis. So greater than 6 months in 14 patients, and in 11 of those it was greater than a year. We estimated that of those 28 patients, the chance of survival had been impeded in 4, and limb salvage would have been possible in 3 of those patients. So without any improvements in technology, if we just organise what we know and use it to our best ability, we can improve survival, and we can save limbs and we can save lives. And that's a fact. Clinical services. Well, Princess Margaret Hospital Paediatric Oncology Department should be applauded for being part of the North American Children's Cancer Group. They've been in that group, a fully paid up member of that group for as long as I can remember. And so kids get the up-to-date treatment. They're on trials and studies registered with the North American Children's Cancer Study Group. We hope to translate our collaborative meetings into collaborative clinics so that patients with the diagnosis of sarcoma, instead of seeing 4 doctors, can see 4 doctors in separate appointments, can see 4 doctors in 1 appointment. So the last thing you want to do when you've got the stress of this disease having been diagnosed is to go from rooms to hospitals and spend all your day finding out what your best treatment options are. Patient advocacy and psychological support, I think, can be improved upon in certain areas. Early access to new treatments, you've got a better chance of getting early access to new treatments if you're in the research field and active in that research field and up to date with the new developments. So we have a better chance of being able to introduce our WA patients to new treatments if we have got a good quality research unit going in WA. And we're entering the age now of developing treatments that are not generic but specific to specific tumour subtypes and specific patients with those tumours. So we're entering a new age where mathematics is dragging biology along with it, and we should be involved in that. One of the studies that we've applied for a grant for is a multidisciplinary study looking at patients a couple of years after their diagnosis, so after they've undergone their chemotherapy treatment, and we're assessing them from a psychological standpoint, a functional standpoint, and a cosmetic standpoint. And we've got specialists from all of those fields, and we'll do an assessment that encompasses all of those functions, a score, treat them, intervene either through physical training, surgery, or psychological support, and then rescore them afterwards. We already know that personal training can make a huge difference a couple of years after patients receive limb salvage surgery. We've had a master's student study that already. So this is just one active project at the moment that's in progress, and it's a collaboration between ourselves, Fiona Wood's group, and Curtin University Psychology Department. Research. This is what Abby was really interested in, and I got from our meeting. And it's great that Hollywood Private Hospital has got together with WAMA and UWA to create an atmosphere that's potentially fertile for sarcoma research. Terry Bayliss takes a lot of credit for working with the WAMA team to develop a good, solid memorandum of understanding so we all know what our responsibilities, both fiscal and professional, are. And we can move forward on this solid basis now from here. And I hope that we make some good progress. And what we're going to be looking at is mutations. Mutations cause cancer. We know that mutations cause the cells to be abnormal and proliferate and grow and spread in an uncontrolled manner. Everybody knows that. The interesting thing is working out what those gene mutations are exactly. And the ability to do a human genome analysis now at relatively low cost is around the corner. And then once we know the genome analysis and we look at the cell and we can try and find out which of the functions the mutation affects in that cell, it opens up opportunities for therapeutic interventions at that particular function, whether it's cell growth, division, transport, movement, motility. Any of those things can provide opportunities for therapeutic intervention. But without getting too technical, I think that we should be involved in that area of research. So far, we've been able to raise a certain amount of funds. There's been a very generous donation from Abby's family to the Hollywood Research Foundation. And the bike ride last week raised a fair amount of money for WAMA. This will support sarcoma research, and the timing is right. Sarcomas are relatively under-investigated when compared with the commoner cancers like prostate cancer, breast cancer, bowel cancer. They're relatively under-investigated, and there are a variety of diseases that are related but also distinct. We have samples stored, frozen, from our patient biopsies that are ready to use for DNA analysis, for RNA expression, and so on. And our hope is that we will establish a collaborative research centre that involves UWA, Hollywood Hospital, and WAMA to advance our knowledge in this field. The bike ride, as I mentioned, we raised $78,000 just in the sarcoma team. The whole bike ride was fantastically organised, raising $4.6 million for cancer research in this state, and Peter Clinton should take the bow for that. It's fantastic. The socket to sarcoma, this is out of date already. I don't know if you can see it at the bottom, it says 13 riders. We've already got 15 riders registered with Peter Ashton, that's 16. Just a hint. So it was a great bike ride. It was the right name for it. And Hollywood Hospital, as you can see by the shirts, these are the socket to sarcoma shirts. An extra attraction for those of you who are considering coming into our team. Beautifully modelled here. But seriously, we want to get 50 riders next time, and then we'll be moving. I'm pleased to say that we've advertised, and we have at least one candidate for a PhD scholarship in Abby's name to look into the genetic pathways in sarcomas. And so that's been advertised, it's funded, and we're starting. I don't have much more to say, except that I would like to acknowledge the people who have got us to this point. Kevin Casserole has been generous. Hollywood Private Hospital have agreed to support the first 30 riders on next year's team, so get your registration in early, is my advice. Peter, 16. Any advance on 16? Terry Bayliss, I mentioned. Peter, who's here tonight and we'll hear from later, and the 19 cyclists who rode down to Pinjarra in a headwind, then rode back from Pinjarra in a headwind. Thank you all. So,